Hello and welcome. My name is Lydia Kaume. I'm a National Program Leader in the Division of Nutrition at the National Institute of Food and Agriculture, or NIFA for short. I'm excited today to moderate today's 7th NIFA Nutrition Security webinar. And today we are honoring and celebrating Black History Month by examining the role of registered dietitian nutritionists and other allied health professionals in promoting and elevating nutrition, security, and health equity. Next slide. So I'm part of a multidisciplinary NIFA nutrition security team, which has been working together for more than a year now. As you can see from this slide, this team has expertise from all institutes at NIFA. I work closely with NIFA's efforts. We all work closely with NIFA's efforts really to strengthen the intersections of nutrition security with climate smart agriculture. Next slide. So to prioritize nutrition security, USDA NIFA has invested more than $200 million in research, education, and extension, and innovation through key programs, which are, as you can see on this slide. But I'll read the 5 key programs that we are investing in. The Expanded Food and Nutrition Education Program, the Gus Schumacher Nutrition Incentive Program, the Food and Agriculture Service Learning Program, Community Foods Projects Program, and the Diet, Nutrition, and Prevention of Chronic Diseases Program, which is part of the larger AFRI program we call the Agricultural Food Research Initiative. So we are also leveraging more than 20 programs that are listed on this slide for these efforts. We believe NIFA's integrated approach positions us to help address food and nutrition security research gaps. This approach mobilizes our broad and committed stakeholders through education and extension to help us build awareness around how to prioritize nutrition security at the local, state, tribal, and national levels. Next slide, please. Today, we are very excited. We have invited panelists who can help us honor and celebrate Black History Month by sharing their insights on the role of allied health professionals, particularly registered dietitian nutritionists, or RDNs for short, in helping promote and elevate nutrition security and health equity. First, on our lineup today, we will hear from Dr. Sarah Bleich, who is the first Director of Nutrition Security and Health Equity at the USDA Food and Nutrition Service. She recently took this position after serving as a Senior Advisor for COVID-19 in the Office of the Secretary at USDA this past year. Next slide, please. After Dr. Bleich's remarks, we will hear from staff and members of the Academy for Nutrition and Dietetics about their efforts in promoting nutrition security and improving the diversity, equity, inclusion, and accessibility among registered dietitians. Specifically, I'd like to introduce ahead of our schedule here, Dr. Judith Camille Anglin, who is an associate professor and program director at California State University in Long Beach, and Dr. Lindy Buckingham-Shutt, who is the assistant professor and community nutrition and health state extension specialist at Iowa State University, and who is also the vice chair of the Legislative and Public Policy Council for the Academy of Nutrition and Dietetics. As part of that team will be Elizabeth Campbell, who is the Senior Director, Legislative and Government Affairs at the Academy for Nutrition and Dietetics. After we have heard from the Academy, We will also hear from Angie Takto, who is the founder and chief strategist at Acta Strategies LLC, who will also provide us a brief overview of her professional practice paper that put forth a conceptual framework for action for the next generation solutions to address adaptive challenges in dietetics practice. Next slide, please. To conclude our webinar today, I will be accompanied by 3 dietitians to have a coffee chat discussion. And these dietitians are federal RDNs. We will have Alison Brown, who is a program director, National Heart, Lung and Blood Institute at NIH, National Institute of Health, and Deirdre Chester, who is a science advisor at the USDA Animal and Plant Health Inspection Service, and Cheryl Jackson Lewis, who is the National Director of the Nutrition and Education, Training and Technical Assistant Division at USDA FNS, Food Nutrition Service. Next slide, please. Before we get started today, a few housekeeping items are, so there'll be additional information about our panelists, and that will be available at our webinar series page that is noted on the slide here. For questions and answers, please use the Q&A function, not the chat box, so that you can submit your questions and we are able to see them in the live webinar. Our registered attendees will be alerted when the webinar materials are posted on the NIFA Nutrition Security Webinar Series webpage, which has several other webinars you can also go back to. We will be updating our webinar materials and adding 5 new web pages on the NIFA's webpage, and the platform will be available for you before the end of this month as we celebrate National Nutrition Month this March. Our 2022 schedule of webinars will be posted out soon as well. Now, let's turn to Dr. Bleich to get our celebration of the Black History Month started. Next.
Thank you, Lydia, and big thanks to the whole NIFA Nutrition Security team. It's really nice to be a part of this special edition of your webinar series. And it's amazing to see how NIFA has assembled more than 60 staff to help the Secretary on his big goals to tackle food and nutrition insecurity. So good afternoon. As Lydia said, I'm Sarah Bleich, the Director of Nutrition Security and Health Equity in the Food Nutrition Service. I have been with FNS for just over a month, but had the opportunity to help out a bit on nutrition security while I was serving as a senior advisor on COVID in the Office of the Secretary. And we'll say that without question, the COVID-19 pandemic brought health disparities and the vital need for access to healthy food to the forefront. Today, I will kick off this Black History Month celebratory edition of the NIFA Nutrition Security webinar series by providing an overview of the intersection between nutrition security and health equity. I'm going to cover definitions of these terms to get us all on the same page and stress including webinar attendees that represent diverse non-government, industry, academic, and other sectors. I'm especially excited to call attention to the invaluable role of allied health professionals, including registered dietitian nutritionists. Before jumping in, I also want to say that I'm very excited that the theme for Black History Month this year is the importance of Black health and wellness. This is a critically important area where FNS has the potential and all of USDA to make a lot of important contributions. I have spent much of my career in public health, mostly focused on food nutrition, so this month's theme is very near and dear to my heart. Now, a few weeks ago, I was able to speak with the Academy's Nutrition Security Affinity Group, and this group, along with our staff and a variety of stakeholders, are excited about the Secretary's passion toward nutrition security. Now, the term nutrition security has been used a lot over the past year since the publication of the JAMA commentary, and the Secretary is regularly using it. What has become clear is that when people hear nutrition security, they are thinking different things, and there is confusion about how it differs from our longstanding efforts to address food insecurity. Dr. Fleischhacker, who you know as Sheila, has said that it's the most common question in the NIFA Nutrition Security webinar series. So part of what we hope to accomplish during National Nutrition Month in March is to get everyone speaking the same language when it comes to nutrition security. And we're going to talk more about that in a second. Another critical part is recognizing that it's a relatively new concept. So we welcome thoughts as we lean in to utilizing our tools on how to best advance diet quality, strengthen the public health impacts of our programs, and accelerate progress in health equity. So the concept of nutrition security, let's talk about that. What it is doing, it aims to better recognize the coexistence of food insecurity and diet-related diseases and disparities. In other words, nutrition security means having consistent access, availability, and affordability of foods and beverages that promote well-being and prevent disease, particularly among racial ethnic minority populations, lower income populations, and rural and remote populations, which includes tribal communities. Nutrition security builds on and complements efforts to address food insecurity among all Americans, but it is distinct in two key ways. The first is that it recognizes that we are not maintaining an active, healthy life. We're not all doing that. The second is that it emphasizes taking an equity lens to our efforts to ensure that there is access, availability, and affordability to foods that will help manage the coexistence of food insecurity and diet-related chronic conditions. This is the definition USDA cited when updating the Thrifty Food Plan, and this is the foundation that we're aiming to build on in our work ahead. So the final term I want to make sure we're all clear on is health equity. So when we say that, what do we mean? Health equity refers to everyone having an equal opportunity to live the healthiest life possible, no matter who they are, where they live, or how much money they make. Now, many of you have been in the food nutrition space for decades, and you might be wondering why the Secretary is so passionately focused on nutrition security now, as we can probably agree that efforts to strengthen the public health impacts of the nutrition safety net have been increasing over the past 2 decades. Here, the answer largely lies with the pandemic and our administration's goals to advance racial equity. What COVID-19 did is it brought health disparities and the vital need for access to healthy food to the forefront. One study, for example, estimated that nearly 2/3 of COVID hospitalizations in the US were related to obesity, diabetes, hypertension, and heart failure. Disparities in diet-related diseases are associated with decades of structural limitations to retail food outlets that sell healthier foods. And these disparities are rooted in other longstanding historical inequities. To make this more concrete, let's think about 2 examples. One is the morbidity and mortality disparities that Black mothers face, which are amongst the highest in the developed world, and driven in part by factors like limited access to quality maternal care and relatively lower rates of health insurance. Another is access to quality food, which is a much larger problem in poor minority neighborhoods. Besides retail food access challenges, accessing healthy food during the pandemic was also challenged, as you well know, by school closures, which halted our ability to serve meals in the traditional way. Without question, promoting food and nutrition security is a critical ingredient to recovering from the pandemic and ensuring racial equity. It is imperative that we prioritize nutrition security and strive to ensure that those who qualify for our programs have no barriers to participation, and those who participate receive meaningful, conveniently accessible benefits to improve their health and well-being. Now, that said, addressing racial inequities will be challenging work, but it will ultimately be the most effective way to ensure we all live the healthiest life possible. I am looking forward to working with the allied health community, including registered dietitian nutritionists, on promoting and elevating nutrition security and advancing racial equity using our federal nutrition safety net, our nutrition education and promotion programs, our dietary guidance assets, among others. Another critical tool is all of USDA's career path and professional development supports that can be invaluable in improving the diversity, equity, inclusion, and accessibility among allied health professions. So what are the key equities our department brings to bear that make us uniquely qualified to lead the federal government on nutrition security? And there are 4 key ones. The first is our nutrition assistance programs, which reach tens of millions of Americans. The second is our nutrition education and promotion efforts, which total more than $1 billion per year across all our programs, with the largest being SNAP-Ed, WIC Nutrition Counseling, and FNEP. The third is by translating the dietary guidelines for Americans through MyPlate and by broader investment in research and food systems. And the fourth is other complementary activities across the department, such as GusNip. So let's look specifically at our work related to nutrition guidance, education, and promotion. Secretary Vilsack is very committed to promoting and supporting nutrition security for all Americans by translating the dietary guidelines for Americans through MyPlate and by a broader investment in research and food systems. As many in this room know from direct experience, our department has also aimed to develop and refine our nutrition guidance, education, and promotion resources so that they provide more culturally and contextually relevant actions that individuals, families, and communities can integrate into their daily lives. This includes efforts to focus more on diversity, equity, inclusion, and accessibility with our current and next generation nutrition education workforce. Over the last year, we have made critical changes to SNAP-Ed and are exploring further modifications to strengthen SNAP-Ed, along with our nutrition, education, and promotion resources, with the goal of promoting positive public health impacts. Some key changes to SNAP-Ed include creating a new nutrition education branch in SNAP to support SNAP-Ed, improving data collection, establishing a national contract for the program evaluation and reporting system, which you may know as PAIRS, and issuing new SNAP-Ed guidance to encourage maximum flexibility in use of PSE approaches, which is policy, systems, and environmental change approaches. All that we do is driven by research and grounded in science. It's woven into our policies, informs each of our decisions, and most importantly, impacts every life we touch. The allied health community, especially registered dietitian nutritionists, play such a vital role in ensuring we translate the latest science into consumer-friendly messages. You demonstrate how it takes a village to understand consumer behaviors, identify messages that reach, resonate, and have meaningful positive impacts, particularly among historically underserved communities. I am very excited to explore further how we can partner with the allied health community, including registered dietitian nutritionists. And this work includes exploring how USDA can use DEIA among other key allied health professionals. So today, I highlighted how USDA aims to honor and celebrate Black History Month through our efforts to advance racial equity and promote and elevate nutrition security. Now, I just want to take a minute to talk about the importance of the allied health community. I mentioned earlier how a few weeks ago, I was able to speak to the Academy's Nutrition Security Affinity Group about the department's nutrition security efforts. I was so impressed at how the Academy has already mobilized more than 50 affinity members. This group was on it as they started just as the Secretary embarked on his goals in this area. From our innovative GusNip produce prescription programs to team nutrition technical assistance and childcare centers to school lunchrooms across the country, registered dietitian nutritionists are frontline workers on promoting and elevating nutrition security. So today, I look forward to hearing about their work to promote nutrition security and improve the DEIA among their profession. I'm also excited to hear from my federal colleagues later in the panel, Lydia, Deirdre, Cheryl, and Allison, about their words of wisdom for the next generation of nutrition professionals. Maya Angelou wrote, and I love Maya Angelou quotes, she wrote, "We delight in the beauty of the butterfly, but rarely admit the changes it has gone through to achieve that beauty." Today, as a product of slavery and a prior recipient of food stamps, WIC, and school meals, along with my brother and sister, I am delighted to honor USDA's work to promote nutrition security and health equity and humbly recognize that we will need to change further to achieve our vision of ensuring all Americans have consistent access to safe, nutritious food for optimal health and well-being. Let me leave you with 3 concluding thoughts. The first is that now is the time to lean in, since food insecurity and diet-related diseases are high. Diet-related diseases in particular are rising due to the pandemic, and they disproportionately impact historically underserved populations. The second is that the allied health community, including registered dietitian nutritionists, play an invaluable role in our department's ability to not just provide all Americans safe access to safe, nutritious, and affordable food, but also to help them understand how to prepare it on a limited budget and how to facilitate consumption across a range of life stages and food preferences. I am a mom of 2 young girls, and I very much understand the importance of helpful, practical tips for promoting healthy eating and engaging youth in positive food experiences. And last but not least, we cannot do this alone. In addition to leveraging USDA equities, we need to effectively and efficiently engage and collaborate with external partners, including the Academy and other professional associations. fostering meaningful partnerships has been a fundamental element of so many of our nutrition security activities. So we look to lift up what has worked and create or enhance additional promising opportunities. So thank you very much for your attention. Happy Black History Month, and I'm happy to take a question or two if there is time.
Thank you so much, Dr. Blige, for your inspiring remarks, and we look forward to visiting with you again and in another webinar series in the future. We have time for a few questions, for one or two questions. As Sarah indicated, if you have a question, please use the Q&A feature to submit a question. And if we do get more than two questions, any of those questions, we will get them answered through email. Please leave your email with us as well as you ask your questions. I just have one question here as we wait for another one to come through. So what is the most cited obstacle to accessing public food programs according to the data?
The most cited obstacle to accessing public food programs? Well, I would say that given the diversity of challenges that different populations face, there isn't one cited obstacle. We know that the challenges to accessing food can be hyperlocal. So for some families, it could be the lack of transportation. For others, it could be the lack of available healthy retail outlets in their area. It could be the lack of childcare so that you can get to the store on your own. So there are all sorts of barriers. And I think that one of the reasons why this group is so important is you have the ability to not just be at the 30,000 foot level, but to actually work with real people in real neighborhoods and find hyper-local solutions, because that's how you can change people's lives and their healthy eating behaviors. It's hard to do that at the 30,000 foot level.
Thank you, Sarah. There is one more question that came through from Ala Hill. She asked, can you please speak more about the plans for National Nutrition Month as it relates to getting everyone on the same page with the language that's related to nutrition security?
Thanks, Ala. I hope I'm saying your name right. That's a great question. So the plan in broad strokes is that our focus during March is going to be twofold, and we're going to bifurcate the month into two pieces. The first half of the month is going to be pushing out what do we mean by nutrition security? And so as we begin to push those resources out, would really appreciate the help of this group to help with amplification and dissemination. There will be a speech that the secretary will be giving in the middle of the month in New York City. And when he does that, he'll be announcing a blueprint for nutrition security, which really packages up and lays out all the work that is already happening, of which, as you well know, there is so much happening within the Food Nutrition Service, within NIFA and elsewhere at USDA. And then what will happen in the second part of the month is we'll spend a lot of time talking about our efforts and all the different activities that the secretary is going to talk about in broad brushstrokes in New York, and then in more detail in that blueprint. So at the end of the month, what we're hoping is that as we think about nutrition security, we are all talking about the same thing. And it's the first step of many. So there'll be lots of things that come down the pike in the next several months that are going to be further reiterating our commitment and our investments to really doubling down on nutrition security at USDA. It's a great question. Thank you.
Thank you. Thank you again for your remarks, Sarah. We will move ahead now and transition to the Academy of Nutrition and Dietetics team and their slides. Thank you.
Excellent. Well, thank you, Lydia, and for your warm welcome. And Sarah, thank you so much for your wonderful remarks. And I was just so moved by your Maya Angelou quote. And Maya is also my favorite poet, and that named my daughter Maya in honor of Maya Angelou. So thank you all for having us. We are really excited to share the Academy's work at the intersection of nutrition security and health equity initiatives. And I thought I'd start today just by introducing my co-presenters from the Academy and sharing our agenda. So first we have Lindy Buckingham-Schutt, who is an assistant professor in community nutrition and health state extension specialist at Iowa State University. And Lindy is our vice chair of the Academy's Legislative and Public Policy Committee, which is the committee of members that really helps drive all of the policy priorities and policy engagement of the Academy. What Lindy's going to do is she's going to paint the picture of how the LPPC develops our policy priorities. And then we'll share a little bit about the top policy priorities that we're working on right now that intersect at nutrition security and health equity initiatives. And then after Lindy, we will hear from Dr. Judith Englund, who is an associate professor at Long Beach and who is our policy and advocacy liaison for NOBIDON, which is a member interest group, which is the National Organization of Blacks in Dietetics and Nutrition. And Judith is going to spend her part of the presentation really talking about the opportunities that the Academy has provided for Academy members to engage in policy work, especially as it relates to nutrition security and health equity. So I'm really excited for Judith to share her experience with all of you. And then lastly, I am Liz Campbell. I am the Senior Director of Legislative and Government Affairs. I will share a little bit from our membership team on our IDEA committee work and what the Academy has pledged to do over the next few years to address diversifying the workforce, and as an association, which of our priorities will be focused on health equity initiatives. So with that, I will turn it over to Lindy.
Great, thank you, Liz. And if you can go ahead and go to the next slide, perfect. Okay, as Liz said, to get started today, I'm going to talk to you a little bit about the Academy's work and what they're doing at the intersection of nutrition security and equity. First, I want to tell you a little bit about the Academy's racial and ethnic health disparities and chronic disease brief and how it was developed. This brief was developed by the Academy staff in coordination with the Policy, Equity, Diversity, and Inclusion Affinity Group, which is a group that connects members with an interest, experience, and expertise in a specific policy area and gives them the opportunity to learn more and advocate. Allison Brown, who is one of the panelists you'll hear from later today, helped create this brief. It was reviewed by the Academy's Diversity and Inclusion Committee and approved by the Legislative and Public Policy Committee. This brief was developed and launched just over a year ago in January 2021. And as you can imagine, it is already up for review and needs to be updated. So if anyone's interested in working with a group that will update the brief, please reach out to Liz and we can drop her information in the chat for you. Next slide, please. Go ahead and go to the next one. So I'm not going to go into specific details of the brief, but I will share some of the highlights. First, in the policy team, issue briefs are developed to educate members about important issues that we want them to be prepared to advocate on. In this case, we are aiming to create a document that would help describe the social determinants of health and how they drive health disparities. The brief is structured using the following 5 social determinants of health. 1, education. 2, economic stability. 3, social and community context. 4, health and healthcare. And lastly, number 5, the built environment. Okay, go ahead and go to the next slide, please. Again, keeping in mind the audience and the use of this brief, we touch upon the following items to help members draw the connections between the issues and policy recommendations. The education section of the brief provides information on school resources, student bias, the school to prison pipeline, and student loan debt, and how these factors can contribute to health disparities. Next slide, please. Under the economic stability and community context section, the brief provides information about how poverty, unemployment, and food security contribute to health inequities. It also outlines how redlining and incarceration rates of minorities has had an impact on generations of people. Next slide, please. Lastly, the brief dives into access to healthcare and the built environment. These sections are important to underscore as the Academy promotes efforts to diversify allied health professions and our field of dietetics, as well as promote healthy food environments. Next slide, please. So ultimately, the brief helped to summarize the following statements. Number one, the Academy of Nutrition and Dietetics recognizes that it is essential to address the root causes of health inequities instead of trying to place a temporary Band-Aid over the problem. Number two, only by fully examining the social determinants of health can health equity be achieved in our society. And lastly, the Academy will continue to advocate for policies that are aimed at improving the social determinants and their impacts on healthcare, education funding, food security, and medical nutrition therapy. As I mentioned before, this was the first step in educating members, and we are working to review and update the brief and to update the recommendations because many of our policy priorities we are working on at the time of this publication have evolved. Next slide, please. So now I'm going to turn a little bit to talk more about specific policy priorities that we are working on to address nutrition security and health equity. I just want to stress that this is just a handful of our top priorities and not an exhaustive list. So if you want more information, please get in contact with Liz or myself. Next slide, please. First of all, we want to highlight our appropriations ask for the Education Department to help diversify allied health professions in the US. We know this is a critical need for our profession and for the people our members serve. The Academy wants to fully represent the people we serve and wants to hear from diverse voices. The Academy will continue to work with the National Association for Equal Opportunity in Higher Education to advocate for grant funding for historically Black colleges and universities and other minority-serving institutions to expand or open new allied health training programs, including dietetics, in an effort to help diversify our profession and to help provide culturally appropriate care. Next slide, please. Now let's talk about some of the federal nutrition programs that are at the intersection of nutrition security and health equity. And I think Dr. Bleisch already did a really great job of overviewing why these are important. But the Academy believes as a first step to nutrition security, we know that we must first establish access to consistent healthy amounts of food. You will see here a few programs highlighted. So let me touch on some of the active strategies we are working on in these different food assistance programs. So first of all, I want to talk a little bit about WIC. As many of you on this call know, WIC works. A study by Robert Wood Johnson Foundation examined the impact of the change in the WIC food package and what effect it had on children's diet. What they found is that not only was there a significant decrease in overall obesity rates for children aged 0 to 4, but there was also an increase in breastfeeding rates, which we know leads to healthier mothers and babies. The Academy is currently working legislatively to support increased access to WIC by supporting the WIC Act, which extends postpartum women's eligibility to 2 years, extends child eligibility to age 6 or the beginning of kindergarten, and extends infant certifications to 2 years. We also support the Modern WIC Act to apply lessons learned from the pandemic and to help extend the increase in the cash value benefit to support more money for fruit and vegetable purchases. Additionally, the Academy is supporting USDA's efforts to review and update the WIC package to align with the dietary guidelines for Americans. And specifically, we have an open action alert for our members, asking them to reach out to their members of Congress and encourage them to sign onto a Dear Colleague letter that will support efforts to provide enough money in the next spending package to increase the value of WIC package. Moving on to school nutrition programs, the Academy has been very vocal and supportive of USDA's effort to set transitional nutrition standards to help us get through the pandemic, while placing an eye on aligning the standards with dietary guidelines for Americans, including supporting the establishment of sugar standards. We also are very concerned about providing waiver authority to the Secretary of USDA to continue much needed flexibility through the pandemic and have an open action alert that members can take on waiver authority. Another top priority is helping increase access to SNAP and to promote incentive programs like GusSNP to help bridge the gap between access and improve nutrition status. We're also working to strengthen and promote the importance of policy, system, and environmental supports coupled with direct nutrition education in order to promote nutrition security. Next slide, please. Turning back to one of our key strategies to supporting nutrition security for all children is our support for healthy school meals for all. On this slide is a leave behind that we are sharing with Academy members and members of Congress to demonstrate the Academy community, health, and equity benefits for healthy school meals for all. And then go ahead and go to the next slide, please. We'll drop a link to this. This is a video that the School Nutrition Services Dietetic Practice Group just released. So I would encourage you all to go to this link. It's a short 1-minute video, and go ahead and watch it to learn more about our efforts around healthy school meals for all. Okay, next slide, please. Let me also share some other policy priorities to address nutrition security, namely the introduction of the Medical Nutrition Therapy Act in the 117th Congress. This bill would expand Medicare Part B coverage of MNT to a wide range of conditions beyond just diabetes and renal disease, which is what is currently covered. The bill would significantly increase access to critical nutrition services that can help improve nutrition security and also address health disparities and access to care. Next slide, please. Now that we've shared our priorities, I want to touch on the opportunities that exist for dietitians to get involved in advocating for these important priorities. First, the Legislative and Public Policy Committee runs a number of task forces that are made up of experts in policy, research, and application to develop policy stances or recommendations for current legislation. Currently, we have 4 active task forces, and we have 1 that will be starting soon. So those include the Healthy and Sustainable Food Systems Policy Task Force, Nutrition Education Task Force, Telehealth Task Force, Child Nutrition Reauthorization Task Force, and then the upcoming one is the Farm Bill Task Force. If you want to learn more about these, please contact me, and I will drop my contact information in the chat as well. Okay, next slide, please. I also want to focus on the opportunities that we have provided for our nutrition students. Policy initiatives and advocacy team at the Academy has been able to pivot quickly in the face of the pandemic and offer virtual advocacy student rotations. In just the last 2 years, the Academy has hosted over 40 interns and currently has 4 active students. It has been a successful way of providing more opportunities regardless of socioeconomic status. Now I'm going to turn it over to Dr. Judith Anglin.
Thank you, Lindy. Good afternoon, everyone, and thank you for this opportunity. I would like to spend my time talking a little bit more about the opportunities offered in policy by the Academy through the eyes of a member. As stated, I am the Policy and Advocacy Liaison for NOBIDAN, and NOBIDAN is the National Organization of Blacks in Dietetics and Nutrition and Dietetics. It is the largest member interest group of the Academy. My primary role is to weigh in on the Academy's policy efforts and then communicate them to NOBIDAN members. Specifically, I want to focus on 2 member opportunities that I have participated in. The annual Advocacy Summit is one, and the other is the monthly affinity group meetings. As a first-time attendee of the summit this year, I want to share my experience with you. This year, the summit focused on the Medical Nutrition Therapy Act and Child Nutrition Reauthorization. There were over 600 participants, and approximately 80 of them were students. The students were all awarded scholarships to attend. The Academy did an excellent job training attendees not only on the Medical Nutrition Therapy Act and the Child Nutrition Reauthorization, but on how best to advocate. The training also included persuasive communication and details on how best to approach members of Congress based on shared values. The training not only boosted my skills, but my confidence as well. I can only imagine how powerful our profession could be if every nutrition and dietetics professional activated their voice for change. This leads me to the affinity groups. While the summit is an annual event, the Academy hosts monthly affinity group meetings. There are 5 affinity groups, namely health equity and diversity, nutrition security, medical nutrition therapy, licensure, and maternal and child health. The meetings provide an opportunity to learn more about what is happening in Washington, D.C., and the participants are given a call to action on the various issues. From my unique lens, the affinity groups also provide an opportunity to network and to make significant contributions to policies. Based on my experience, I would encourage members and attendees of this webinar to attend, because you're important to the profession. Your voice matters, and the Academy wants to hear from you. Together, we are making a difference. In closing, next slide, please. In closing, I want to share with you the next affinity meetings that are scheduled. The Health and Diversity meeting will be held this Friday, February 25, and this meeting occurs every fourth Friday of every month. The focus of that meeting will be on the workforce diversity issue brief that the Academy is currently working on. Members of this group will be asked to review the brief and provide their feedback. On Wednesday, next slide, on Wednesday, March 2nd, and this meeting will occur, and this meeting is for the Nutrition Security Affinity Group, and they meet every first Wednesday of each month. At that meeting, they will be discussing the WIC package, increasing the WIC package value, and to extend USDA authority for child nutrition waivers. Thank you, and I hope you'll be able to attend the affinity group meetings. A link to register for the meetings will be provided in the chat. I now hand back the reins to Liz.
Thanks, Judith, and thanks, Lindy. I believe they just dropped the Nutrition Affinity Group registration link into the chat box. And actually, if you go to that link, it will take you to all 5 of our affinity groups, and you can choose which ones that you want to register for. And again, they are happening on a monthly basis. What I want to focus on now is I just want to share a little bit about what our IDEA, or Inclusion, Diversity, Equity, and Access Committee, has been working on, and share the resources that they have put out. And hopefully, for those of you who are not familiar with the IDEA Hub, you'll get an opportunity to check it out. I'm going to share some high-level highlights of the hub, but certainly welcome any emails or direct questions at the end, or feel free to contact me directly, and we will get you to the right Academy staff person. So the first thing I want to point out, we actually have a microsite part of the Eat Right Pro site, where it is the IDEA Hub. And there sits a number of resources, including some videos and webinars that the Academy has hosted. It has a welcome message from our committee chair, and it also has what I think is probably the most useful document. It's such a great document on the website, is the IDEA Action Plan. Next slide. So this is a snapshot of the IDEA Action Plan, and let me just share a little bit about how it was delivered. So this is a sustainable living document. I think what we've all learned is that each day, the work that we do in this area is evolving, and we want to be able to react to new information that's provided and feedback from Academy members. So let me just preface this whole thing that this is a working document. It was designed by our IDEA committee, and the goal was to move the nutrition and dietetics profession towards an increasingly welcome and inclusive future. And Judith and Lindy and I were talking about this yesterday. I think it's really important to stress that this document is a living document. It was developed, and that it's so important to hear from Academy members and to see that there is change when this information is developed. So this, we wanted to stress that we want to hear from Academy members and that your voice is making a difference for sure. So let me just continue on with the point of the action plan was to create goals, strategies, and measurable tactics that were carefully developed from member and professional feedback gathered from internal and external stakeholders. And in late 2021, early 2022, this committee surveyed academy units and groups to establish baseline data, providing a point from which to measure continual growth in this area. And I think that's incredibly important as we hear the call for transparency and moving forward, making sure that we have baseline data available and then providing updates on progress to these goals, I think is critical and something that we've heard and that we are acting on. So let me just briefly share what the 4 goals are, and then I'll end with an article that was just published in January that really summarizes all of these activities. So the first goal is to establish infrastructure and resources to achieve optimal and sustainable IDEA outcomes. The second goal is to increase recruitment, retention, and completion of nutrition and dietetics education and leadership at all levels for underrepresented groups. You can see how some of these goals are impacting the policy priorities that Lindy shared that we are working on to help diversify the workforce. The third goal is to cultivate organizational and professional values of equity, respect, civility, and anti-discrimination. And then goal 4 is to advance food and nutrition research, policy, and practice through a holistic IDEA lens. And what I really like about this document is that it is used and referred to in all of the Academy's departments when we're thinking about the activities that we're working on. And of course, want to point out that we have included health equity as part of the strategic plan, and it is its own bucket in the policy team's strategic goals for and policy priorities. And then Sheila, next slide. Lastly, I just want to share that this article was published in January that gives a great overview of the development of the committee, of the action plan, and what some of the timelines and milestones are, and when folks can expect to see reports on progress. And with that, I'm going to turn it back to Lydia and see if we have time for questions.
Yes, thank you so much. We have a few minutes for questions. What an outstanding overview and almost a deep dive into some of the Academy's work in promoting nutritional security and health equity. I think I will agree that you had a number of opportunities that our attendees can join in and lean in, as we were encouraged by Dr. Blige to just lean in into these conversations. There's quite an opportunity here with the Academy to join and be part of something that makes a difference. So we have some time for a few short questions. Please submit your questions through the Q&A Zoom feature, not the chat box. I'm not seeing any for the Academy coming through. Remember, any unanswered questions that come through, we will provide the answers via email after the webinar is over if we cannot get to all your questions. Please submit your questions through the Q&A feature. Okay, we don't have any questions. I do not see any question coming through for the Academy. So we will transition and welcome Angie Takto to present her slides. Thank you.
Great. Thank you, Lydia. Good afternoon, everyone, and thanks for this opportunity to join you this afternoon. Since stepping out of my role as the Executive Director of USDA's Center for Nutrition Policy and Promotion, I've had the amazing privilege to work with individuals, teams, and organizations to build their strategic capacity and leadership opportunities so that they can direct systemic transformation. We often use the terminology PSE, or policy, system, and environmental approaches, and specifically at this nexus of nutrition, public health, and food systems. Next slide, please. You know, the dietetic profession, as well as the broader nutrition, public health, and healthcare communities, are experiencing unprecedented challenges. This is just a sampling of the many human health, social, economic, ecological, and political challenges that are influencing food and nutrition today. And I think it's safe to say it's really messy. But if we begin to untangle this web, we'll begin to see these interconnections between these challenges, especially between food and nutrition insecurity, health disparities, inequities, and racial injustices. Next slide, please. We also have a spectrum of descriptions, and as Dr. Fleisch mentioned, this is an emerging space on food and nutrition security. And as you review just the sampling of 4 descriptions, you'll see that there's a kind of a domestic context and a global context. Some of them address various social ecological dimensions, including individual, community, population, policy, and systems elements. There are also implicit to explicit connections between food and nutrition security and equity and justice. They may also allude to either downstream or upstream solutions, and they may infer either deductive methods, so determining a conclusion or a direct cause and effect, and or inductive methods where we're trying to identify the probabilities and the possibilities. We also have, quantitative methods to assess individual and household food insecurity, great part and thanks to USDA Economic Research Service. And as Dr. Fleisch mentioned, nutrition security is an emerging construct. But as we broaden the scope of nutrition security, for example, if it does align with a socio-ecological model, we increase that complexity. This requires interventions that align with this scope, and we need to rely, I think, on a more mixed approach for assessing food and nutrition security. Next slide, please. I think we would agree that there is great complexity, as demonstrated by the speakers so far, in addressing food and nutrition security and health equity. The question is are they indeed adaptive challenges? Well, adaptive challenges often referred to as like wicked problems or complex challenges or complex problems, but they're oftentimes novel or unique. There's nothing cookie cutter about them. There's like a no stopping rule with adaptive challenges. You can't just hit the pause button and say, you know what, I'll get back to that later, or I'll address that next week. The problem is never fully understood. They're very complex. They have no single cause, therefore no single effect, and no single solution. And the potential solutions to adaptive challenges have to be tailored to the problem. There's no off-the-shelf best practice answer. There's no protocol or policy that we can go to and simply implement. Solutions also are not necessarily right or wrong, but the solutions may be better or worse. Next slide, please. Regardless of the description of nutrition security and the advances that we make in describing nutrition security, there's numerous factors, there's numerous players, environments, policies, and systems that influence and contribute to nutrition security and health equity, making it an adaptive challenge. Next slide, please. So how do we address this dual adaptive challenge? Well, we need to take what I would call an abductive approach, in which we closely examine the evidence, often the what, and that what is most often in a quantitative form, but we need to follow with why, often in a qualitative form. And we need to explore this broader landscape and also glean stakeholder perspectives. This creates a rich assessment in which we can make informed decisions about strategies and solutions to move forward. So I propose the following 3 steps to address the adaptive challenges of food and nutrition security and health equity. Next slide, please. In my experience, we cannot discuss food and nutrition security without an integrated, very deliberate discussion on health and racial equity. I propose a root cause analysis. We've heard that term already today. A root cause analysis approach that combines our epidemiological information, or the what, with social, economic, environmental, and political factors, or the why. When we take a root cause approach, systems thinking becomes inherent, and it allows us the opportunity to see those patterns, to see the relationships and the interconnectivity among those factors. It also helps us to see the boundaries of our adaptive challenges. And most importantly, it allows us to see the perspectives, the mental models, and biases of stakeholders, partners, and our constituents. But this requires us to approach our program and community health assessments, for example, using broader parameters, what I call a determinants of health lens. But I think today it's more apropos to frame this as a determinants of nutrition, or in the context of nutrition equity, to not only get at the what, and the why. So Lindy's already set us up on the factors of the elements within the social determinants of health and applying that lens to food and nutrition security. But I would also like to amplify the need to also assess our public health capacity, as well as our social and cultural capital. But I also want to pair that with what we call the commercial determinants of health, to be able to explore the private sector's role and their influence on nutrition security and equity. Also to explore their behavior around things such as advocacy and lobbying, their marketing and pricing tactics, as well as their role in the global supply chain, for example. But the third piece of this step one puzzle is the political determinants of health. So that allows us to examine how public policies, regardless of the level of public policy, the public policies, the public policy making processes, power constellations, as well as political interests and ideologies impact nutrition security and health equity as well. I recognize that these are very tough questions to ask, but if we don't ask the questions and we don't apply these lenses to our conversations, we don't fully understand the myriad of influences on nutrition security and equity. We're not going to be able to be equipped with sufficient information to make informed decisions, which leads me to step two. Next slide, please. So we take that rich assessment, that information, to formulate and implement strategic multidimensional solutions that strengthen nutrition security and advance health equity. These 7 action components are heavily influenced by the spectrum of prevention, and they support the implementation of a continuum of strategies. The aim, therefore, is to develop coordinated strategies both within and across the 7 action components. This creates almost like a multiplicative and greater sustainable impact as compared to a singular strategy. So once a suite of what I would call synergistic strategies are implemented, we move on to step 3. Next slide, please. So step 3 guides us in aligning our evaluation with our multidimensional strategies. And you'll see that, this very rudimentary graphic has a social ecological approach to it. The dimensionality of our evaluation should support our equally dynamic solutions, working backwards a little bit more, and should also support the complexity of our adaptive challenge. Logic models are great tools to map dynamic evaluation methods and can support a mixed methods evaluation in which you're getting at the what and the why. When we can do that, we can share the outcome data and a remarkable story. Next slide, please. When we put these steps together and weave systems thinking and systematic reflection into our processes, a framework for action takes shape. This is a versatile tool that can support our efforts in tackling adaptive challenges, including but not limited to nutrition security and health equity. The detail of these 3 steps can be found in the cited reference on this slide, and we'll also paste the link to the article in the chat box too. Next slide, please. Tackling food and nutrition security using a health equity lens requires interdisciplinary partnerships and multidimensional approaches, and perhaps even more importantly, adaptive leadership. Ron Heifetz and colleagues describe adaptive leadership as the practice of mobilizing people to tackle tough challenges, but to also thrive. This is what has inspired me to develop the I+PSE conceptual framework on the previous slide as a tool that we can add to our toolboxes and to help us build our capacity and our confidence in tackling adaptive challenges. Next slide, please. So I think the link to the article is now in the chat. Thanks again for the opportunity to be part of this dynamic discussion today, and I'll hand it back to Lydia. Thank you.
Thank you so much, Angie. That is such timely content right there for us to chew on and think through. In the interest of time, we will move to our next session, but I would like to remind our attendees that if you have questions, please submit them and they will be answered. Submit them through the Q&A feature on Zoom, and they will be answered. Please do submit with an email as well, so that can be answered by the panelists. And then it's time for us now to have that coffee chat we talked about. We have had a lot today, but before we could react to it, I'd like to invite my colleagues here to, introduce themselves, tell us a little bit about your professional journey, how you got to where you are, and just highlights of your professional journey to being in the federal service as a registered dietitian. And we are going to start with Dr. Chester, and then we'll go to Cheryl, and then we'll go to Dr. Brown.
Hi, I'm Deirdre Chester, and I started my federal journey as a postdoc at the Agricultural Research Service, and I was there for about 8 years as a scientist. And one of my goals was to be a funder of research. And so I next moved to the National Institute of Food and Agriculture, where I was a national program leader for applied nutrition research. And so in my present role, I serve as the science advisor for the Animal and Plant Health Inspection Service. So that's kind of a nutshell of my federal service.
Good afternoon, everyone. Cheryl Jackson Lewis. So my career trajectory started really at the local level and working in the child nutrition programs, and then going to the state level, and now into the federal level of working in the child nutrition programs. All of this experience culminated with me being able to work at the U.S. Agency for International Development, working in child nutrition programs in Africa, Asia, and Latin America, which was a fantastic experience. And then coming back into the domestic programs and serving now as the National Director for Nutrition Education Training and Technical Assistance. So I'll turn this over to Allison.
Thank you, Cheryl, and hi, everyone. So I started my federal service as a AAAS Science and Technology Fellow at the National Institutes of Health, and particularly the National Heart, Lung, and Blood Institute. And then I transitioned to a program director where I support researchers doing work around food insecurity and nutrition and health disparities. And then I co-lead a trans NIH group on nutrition and health disparities in alignment with NIH's strategic plan for nutrition research. But prior to that, I have experience in nonprofit leadership, as well as in smaller nonprofits. I worked at the Center for Science in the Public Interest and did work in terms of their nutrition policy and advocacy efforts.
Well, thank you so much for sharing those experiences. I'm sure we will have questions in the audience of people who may want to know how to get to through the federal service, your pathway to that a little bit more in depth. But we've had a lot today. Listened to quite a bit of inspiring and also thought-provoking content here. I just wanted to give you an opportunity to reflect on it and share with the audience anything that got you thinking or aligns with the work that you do, and in a way can elevate the work that you do.
Yeah, I'm happy to. Oh,
go ahead.
Yeah,
sure. Go
yeah,
ahead,
I was just saying, if we're going to do it popcorn style, I'm happy to just jump in. But something that resonated with me in the last talk with Angie was really addressing nutrition security requiring a multi-sectoral and multifaceted approach. When we often think about nutrition, we often work in our silos, but I think it's important to really foster partnerships with a variety of stakeholders, so different federal agencies and private sector, including the food industry, as well as the nonprofit sector, and kind of piggybacking off of the idea of the social determinants of health, looking at economic stability and quality of education and neighborhood and food environment and what is accessible at the neighborhood and food environment level. I think it's going to take and require a lot of different collaborations beyond just the nutrition space. So when we think about the average household in America, housing is typically the largest expense. So, and cost of living increases, and with inflation that's happening, we need to consider a holistic approach and better support policies that help the average American survive, and that goes with increasing the minimum wage and so forth. So I think, just thinking more broadly about policies that impact the well-being of Americans is going to be critical.
Yes, and I can piggyback on that. I think one of the things that I thought about during Angie's presentation was really the commercial determinants of health. And, I have worked at ARS, and one of the programs that I worked on there was the USDA Food and Nutrition Summer Institute, where we worked in African-American communities, Latin American communities, but also tribal communities, really looking at access, availability, and affordability of food in those communities. And I think oftentimes we don't really pay close attention to the commercial determinants of health, meaning how people get their food in communities. And I think that that is a big component, because it really centers around marketing, affordability, availability, but really access to that quality food, not for all Americans. And that includes rural and remote communities. So I think that that's one of the things that really got me thinking about getting back to that kind of work, because it is so important as we think about the social determinants of health in communities of color across our country.
And as I was thinking about the collective presentation, we're always considering this from the operationalization of nutrition security, and what does it mean to our child nutrition program operators at the very local level, and how is this going to help our program operators in being more efficient in the program. And some of the things we've been working on really to address this is looking at our child nutrition program resources and trying to determine how we're developing these resources for persons with limited English proficiency, for example. And we're cognizant of the fact that we have to develop culturally appropriate training materials, technical assistance materials, and nutrition education resources. So what we have done is actually take our materials and develop 130 Spanish language publications just for our child nutrition programs, because we have recognized that a lot of our workforce are Spanish speaking now, and within the child nutrition program, school nutrition, and even in the child and adult care food program. And we have to develop materials for that particular audience. We've even branched off into developing standardized recipes that are multicultural and looking at the diversity of our audience and making sure that we have available products that can be used throughout the child nutrition programs. Doing things like developing cooking videos in Spanish for our CACFP audience. So it's these type of activities that we're working on to ensure equity down at the local level with the workforce and also for our audience. And you're on mute.
Yeah, thank you. Thank you for those comments. I was also reflecting on the commercial determinants and the political determinants of health, and thinking about the adaptive challenge that Angie really dealt on. And I know for you all, you may have worked on some fields that are outside of nutrition, you know, like social determinants of health in your work to try to, you know, get to nutrition security. Could you share a little bit of that for what you have done outside of the, you know, the core nutrition education or core nutrition research, but things like housing? What are some things you could share with the audience that you have done?
Allison, do you want to start us off?
Yeah, I'm happy to jump in. Sorry about that. Yeah, so at NIH, we have several different working groups internally that focus on social determinants of health. So it's very much an active area of interest for NIH. And particularly, we have a working group that focuses on housing and health and looking at how housing and the rising cost of housing impacts various health outcomes. So it's very much of interest, and then thinking about the economics and how that plays a role into the affordability of healthy foods. And last September, we actually held a workshop focused on nutrition on neighborhood food environments, as well as food insecurity and various health outcomes. So we had over 3,600 in attendance, and a lot of different scientists from across the country speak on the topic. But health equity was a running theme throughout the workshop, and talking about needing a comprehensive approach to address nutrition security, and again, moving beyond silos to really address the underlying issue of economics that contribute to disparities that we see.
And I think for me, I am no longer working in the area of nutrition, but when I was at NIFA, I think of the portfolio and working with the cooperative extension community and also the FNEP community. And really, those are areas that are outside of nutrition, but directly impact nutrition and social determinants of health. And so those are things like working with underserved communities, but working in also rural and remote areas, and really targeting those populations that are underserved, making sure that we're increasing their access to quality foods and their access to food outlets, but also other things like improving the lives of those consumers and families through nutrition education, food safety training. So all of those are closely related to nutrition, and they actually Extension really emphasizes taking the knowledge that's gained through research and education. So all of those research portfolios that we fund, making sure that we bring those directly to people so that they can create those positive changes in their lives. And so, you know, Extension and FNEP actually has the possibility to tackle those social determinants of health so that they can also educate our future generations.
And our work in the child nutrition programs is also very closely related to what Deidre has just indicated, very much along those lines. So I just want to ditto what she's already said.
Absolutely, and the extension works with the FNS quite a bit in terms of taking that nutrition education back to communities and helping even with some of that translation sometimes of education materials. So that's really helpful. I would like to kind of pivot and you know, we are honoring the Black History Month, and I would like to hear from you all, what are some favorite ways that you all celebrate Black History Month?
Oh, I celebrate Black, do you mean personally or professionally?
Well, either. Either is good, however you want to share.
Okay, we just, as a tradition, just spending a lot of time with family and friends and cooking great meals and socializing with one another. And professionally, ensuring that our staffs attend a lot of the Black History Month webinars and presentations that are being made throughout USDA. In fact, we had 2 great sessions today. And so that's that's one of the ways we're celebrating.
Yeah, I was happy to see that this webinar was being planned by USDA. I personally feel strongly that Black history is American history and should be celebrated all year round, but certainly understand the impetus for the founding, and it starting off as a week and then evolving into a month. But personally, I really try to support Black-owned businesses in my community, whether that be restaurants, and I know several cities that I've lived in have kind of a repository of Black-owned businesses in the area and restaurants. So trying to just continue to be a patron to those organizations and supporting friends that have their own businesses and whatever they sell, just trying to support in that way.
Yes, and I would say that, Allison, that's actually a way that I celebrate is just making sure that I celebrate those Black-owned businesses. And I too celebrate all year and just really spending quality time with people. I think the other thing that I do to celebrate Black History Month is just making sure that I'm kind of hypersensitive at this time of the month to check into those that I mentor, those students that look like me, any opportunity where I can highlight my journey so that they can see someone that looks exactly like them and know that they can do this too. And I think that this is just the fact that I'm here is a way that is celebrating and honoring all of those great mentors. I say those great mentors on whose shoulders I stand. And so making sure that I'm able to pay for the mentorship that was given to me on a daily basis to others.
Thank you for sharing that, all of you. And I would share that I do feel similarly around, how much mentorship has meant for me in my path to where I am. And I think it was Allison, you shared about being in a fellowship, and Deidre, you shared about being a scholar. At least I know you were an 1890. The 1890 scholarship is something you hold dear. So you have shared a little bit about that, but would like to hear more about that mentorship and what that means for especially Black students at all levels.
Yes, I've been very fortunate to have great mentors. I've had great mentors in the federal government, but I've also had an opportunity to be a mentor to many students. Not only 1890 scholars, but Thurgood Marshall scholars, pathway students, and also the USDA Food and Nutrition Summer Institute. And that is really just an opportunity for us to reach back and bring someone along. At NIFA, I smile every time I get an opportunity to speak to one of the scholars there, which is now a program specialist, Ryan Cornegay, because those are the opportunities that really bring a big smile to my face, because it really means that programs like the 1890 scholars do work. And, to see colleagues that were 1890 scholars and now are in prominent places in the federal government. So I think that those are very important ways, because like myself, I came into the federal government as a postdoctoral fellow. A lot of times it seems like a daunting task to get into federal service. But I also understand the importance of ensuring that students of color are able to access federal service in what I would consider non-traditional ways. And I also entered the federal government in what I would consider a non-traditional way. So I think it's important.
Yeah, and just to piggyback off of that, and I mentioned this in my intro, that I participated in the AAAS Science and Technology Fellowship, and that's a nice pathway into federal service. There are two different tracks to that fellowship. One is the executive branch track, and the other is the legislative branch track. I opted for the executive branch and interviewed at several different federal agencies, but really found a great home at NIH. But other fellows are paired with a range of federal agencies, so Department of Defense, USAID, the State Department, several fellows go there, but it's really a great opportunity to apply your skills in a PhD program to a federal service program. But there are other kind of pipeline programs for federal service, such as NIH's National Cancer Institute Fellowship. And that also allows you to get an MPH in addition to the experience at NCI. And then there's the Presidential Management Fellowship as well, that a lot of folks use as their entry point into federal service. So that's a great opportunity to get your feet wet, if you will, in federal service. And then to your point about mentors, I've had several great mentors along the way. Dr. Evelyn Creighton, the first African-American president of the Academy of Nutrition and Dietetics, who's on this call now. I definitely have to pay homage to her as a history maker that is living, and really appreciate her legacy that she is continuing to build, and through her mentorship. That also, I'm a proud graduate of Spelman College and had a great mentor in their chemistry department as well, who believed in me when I didn't really believe in myself. So, and I've had several mentors along the way that have done the same. And I'm at the stage of my career to do that with high school students, graduate students, wherever they are in their careers.
I'd also mentioned that earlier in my career, I served as a USDA liaison officer at Virginia State University, recruiting 1890 scholars, the best and the brightest students for all of the USDA agencies. And during my tenure, I recruited about 17 scholars for USDA. It has been wonderful seeing them grow over the past 20 years. Absolutely delightful in so many of the different agencies. I'm a graduate of Virginia State University, where I was serving as a liaison. So that was an excellent opportunity to pay it forward and to give back. And even now we are recruiting 1890 scholars within the child nutrition programs. So they're coming on board starting in May. So we're continuing our efforts in that area. We also have invested in internships for Hispanic serving institution, and we've been hiring multiple students who are bilingual. They're tremendous in helping us as we're looking at developing resources and materials. But more importantly, I've started hiring bilingual nutritionists who can really help us to develop webinars and also to present at these national conferences in the Spanish language. So all of that has been very helpful. I will also echo what Deirdre and Allison said about the importance of mentors. Serving as a mentor to this group is so important, and that is one of the pieces of advice I give to all incoming students, is that you really need great mentors throughout your career, and you have to stay close with them over your entire career.
Absolutely inspiring listening to the fact that somebody made a difference in your life, and now you are paying it forward, each one of you. Amazing work. I do pay attention to that, because I've also been mentored, and I see on the chat, Dr. Anglin is saying she's a product of USDA Summer Institute program. We have Angie sharing the Presidential Management Fellowship program as well. Mentorship is so important at all, at every age, really. And even in professional careers, for somebody to see you, to note that you have the potential and the capacity to grow and to actually nurture it with you, that's always so wonderful. And I think even with our registered dietitians, before they get to that internship, they need mentors, they need preceptors. So just welcoming people to mentor as much as they can in to elevate this work of nutrition, security, as well as equity. So we only have 5 minutes, but I would like to give you an opportunity to share with the audience anything you related to Black health and wellness. Any few words you'd like to leave the audience with, point or two. What are some thoughts?
Well,
Alison, you
yeah,
start us off?
I'll jump in. I feel like the power of social media during this era should not be understated. And I know there's several strong and well-followed influencers in the health and wellness space when it comes to Black health and wellness. So previously, I served as the past chair of NOBADAN, the National Organization of Blacks in Dietetics and Nutrition, and worked closely with Judith and many of those on this call. And I worked with a very inspiring group of social media influencers, Gen Xers or millennials, if you call them. And they started a nonprofit called Eat Well Exchange. And their focus is on nutrition education, but with an emphasis on culture to really prevent negative health outcomes for the well-being of Black and Brown communities. And there are a host of other social media influencers that really are focused on elevating the health of the Black community. So I think as much as possible is we could provide those type of influencers with evidence-based and research-based information. I think that's important as well, because the information that's shared, we want to make sure that there's evidence to it. But elevating cultures and the healthy foods that exist in certain cultures, I think is important because we often focus on health equity through the deficit lens. And I think it's important to elevate the assets within the Black community when it comes to culturally appropriate foods that have high nutritional value.
I think one of the lessons I'm taking away is just the continued utmost importance of trying to recruit dietitians of color within this profession and being able to provide the mentorship that they will need to accelerate in this program. As you look at the pandemic and the epidemic of obesity, it goes without saying, based on all of the presentations we've heard today, the necessity of ensuring that we have a diverse group of young people coming into the profession, serving in the profession, so that they can in turn serve the community and do a great job in serving the community. So.
Yeah. I think for me, the last words is I think it's very important for all of those students of color to really know that they belong, and also to seek out the mentors that look like you. You know, there are times where it's going to be hard, but you may cry and feel like you want to give up, but you need a mentor that you can look to and say to yourself, hey, if this person successfully navigated this, that I can do it too. And then I hope that one day people of color can actually show up and showcase their gifts and talents without someone having any preconceived notions of who they are. I think that that's the most important thing. And I think that we definitely can do that.
Oh, thank you so much. And if I had time, I would give a real comment around all the work that you all have shared. But we need to end this. And I would just like to thank you, Alison, Deirdre, and Cheryl, for that thoughtful coffee chat. I hope we'll have a real coffee chat next time we have a nutrition conference together. And as we come to an end, USDA NIFA team, we really want to sincerely thank each of you panelists, including Dr. Bleish, for your inspiring remarks. Judith, Lindy, Elizabeth, Angie, thank you so much for these thought-provoking ideas. And we appreciate every attendee as well. Please continue to send in your questions, your thoughts, and we'll look forward to seeing you next month when we have our next webinar. We hope you have a very special way to celebrate the rest of Black History Month for your organization and your family. Thank you so much. See you next month, everybody.